Spanish for healthcare. In this lesson, we are going to focus our attention in learning basic vocabulary to interact with patients. On this lesson, we are going to cover the following items: salutations, introductions, and basic questions. Let's work a little bit on salutations. In Spanish, you can greet someone with the following salutations: buenos días, buenas tardes, buenas noches, or just simply saying hola. To welcome someone, you will say bienvenido for the masculine, bienvenida, the feminine form. Let's work on basic questions. Remember that when you address a patient, it's most likely that you will address the person in a very formal way. The following questions are written in the formal way. ¿Cómo le va? Which means how is it going? ¿Qué tal? What's going on? Or ¿Cómo está? How are you? Let's review more questions. When you are introducing yourself, you could just simply say me llamo. Or you can say mi nombre es. Or soy, which means I am. As a nurse, you can introduce yourself as soy su enfermera, soy su enfermero. What is your name? ¿Cuál es su nombre? ¿Cómo se llama usted? What's your name? Or just simply asking nombre, apellidos, name, last names, or mucho gusto, encantada o encantado, igualmente. These last three expressions mean nice to meet you. Let's continue working with vocabulary. When you are interacting with patients, you might want to ask the person at the very first time you encounter, ¿En qué puedo ayudarle? How can I help you? ¿En qué puedo servirle? ¿Cómo le puedo ayudar? How can I help you? Or, if you can say perdón, that means excuse me. Or you do not understand what the person say, you just turned it into a question. Perdón? Same thing with disculpe, which means excuse me. You can say disculpe or disculpe. I'm sorry will be lo siento. If you want to hear the person again, you will say repita, por favor. Thank you, gracias. You're welcome, de nada, or no hay de qué. Let's work on patient information. How to obtain basic information. Marital status, estado civil, you can ask directly the patient. Single, soltero for male, soltera for feminine. Casado, divorciado. If it is a child, you want to ask if it is a minor. ¿Es menor de edad? Or, ¿usted es el padre? ¿Usted es la madre? Are you the father? Are you the mother? Or are you the guardian? ¿Usted es el guardián? Or if you want to know if the patient is a relative of the child. ¿Usted es familiar? Let's review some basic vocabulary. Señor, señora, señorita. El niño, la niña. El bebé. Doctor, doctora. El médico, la médico. El paciente, la paciente. El consultorio o la oficina del doctor. You can use these last two words for doctor's office. When you are saying goodbye, we are going to use different expressions of farewells. Hasta luego, see you later. Hasta pronto, see you soon. Or hasta, and you indicate the time you will meet the person again, like next week. Hasta la próxima semana. Casual farewell expressions in Spanish are adiós, chao, nos vemos,